today about borderline personality disorder. This is one of the most common disorders that I see in the hospital and that I'm asked to evaluate or give an opinion about the presence or absence of the disorder. It's an interesting disorder. A lot of people suffer from this, and it's treatable. So we're going to discuss how this disorder develops, how it's assessed, and how it's treated. This is a personality disorder, so it's only legitimately diagnosed at the age of 18 or over. The disorder is characterized by difficulty in three areas: instability in emotional displays, unstable interpersonal relationships, and instability in self-image. What are the characteristics of borderline personality disorder? In regard to emotional displays, individuals with borderline personality disorder are usually said to have dysregulated emotions. Their emotions vary wildly, and their displays of emotions are usually very over-the-top, intense, and difficult to deal with. They find it difficult to control their emotional reactions in a variety of situations. Unstable interpersonal relationships are also a hallmark sign of borderline personality disorder. Individuals with borderline personality disorder may tend to vary in the way that they view people. They can either idealize them or find them to be very, very negative, and the changes in these perceptions can happen very quickly. The persons with borderline personality disorder often have a great deal of friction, and they react very strongly to interpersonal stressors or circumstances. Instability in self-image is really where the term borderline personality disorder came from. The idea was that the personality had only been partially developed or was only in a borderline state of development. This suggests that the individual can vary wildly in their appraisal of themselves. They can go from seeing themselves as being very good in something of a grandiose fashion to being very self-critical and disparaging. There are some characteristics that are usually associated with borderline personality disorder. Individuals with this disorder often have frequent suicide thoughts, threats, or acts. These could be manipulative in nature, but can also be legitimate attempts to end one's life. They tend to have chronic negative reactions to psychosocial stressors. Often, when stressed, reactions are over the top and difficult to manage. They also tend to have cutting behavior or other self-harm behaviors. So how is it that borderline personality disorder develops? In most instances, there are difficulties in one's early family life. This can involve early childhood trauma, a history of sexual abuse, physical abuse, or emotional abuse. It can also include difficulties with disrupted family relationships, situations in which a young person might be neglected or feel abandoned by one or both parents. It's often the case that individuals with borderline personality disorder have a parent that has some form of emotional instability or significant personality disorder. There are ways of assessing personality disorders that tend to be very reliable and accurate. Psychologists tend to be pretty good at assessing the presence of borderline personality disorder or other personality disorders. This is often done through clinical interview and also through psychological testing. One popular test that is utilized is the Minnesota Multiphasic Personality Inventory, or MMPI. It's impossible to get into great detail about MMPI results in this video, and my hope is to cover that in greater length in subsequent videos. The scales that are often looked at with the MMPI involved in borderline personality disorder are Scale 3, which measures histrionic personality traits and strong reactions to psychosocial stressors. This can also involve indirect reactions to stressors and can be associated with the development of physical symptoms that have psychological correlates. In addition, there are often elevations on Scale 4 of the MMPI, which tends to measure impulsive acting out, estrangement in interpersonal relationships, and a tendency to desire immediate gratification of impulses. Finally, Scale 6 often shows elevations as well, and this deals with interpersonal distrust, suspiciousness, and feelings of paranoia interpersonally. There are a number of treatment strategies that tend to have good track records. Psychiatrists may prescribe antidepressant medications, and in cases of severe mood instability, mood-stabilizing medications. Psychotherapy techniques can also be helpful for individuals with borderline personality disorder. Sometimes individuals are treated in short-term, long-term psychotherapy in which they return to therapy periodically in short stints, but for a long period of time in the aggregate. In addition, individuals seem to benefit from techniques drawn from dialectical behavior therapy, a particular type of psychotherapy that tends to do well with borderline personality patients. Don't forget to subscribe to our series on diagnosing and treating various psychiatric disorders. This video was produced by Knoll Psychological Group. You can learn more about our organization, our services, and our providers at knollpsychgroup.com. We also provide psychological and neuropsychological evaluations by smartphone using our exclusive PsyScreen platform. You can find out more about that at psyscreen.com. That's PSYSCREEN.com.